Welcome to Pathophysiology. This concept map is designed to introduce you to the framework and important terminology that will help you master your pathophysiology course. At the end of the video, your completed map should look like this. Remember, you can find both the blank and completed concept maps at the Etsy site, and the link is in the comments. So let's get started with our blank template. We should first introduce you to what pathophysiology actually is. Physiology was the study of normal body functions, but pathophysiology is the study of diseases when the body is not functioning normally. In patho, we study how the body responds to disease. So with pathophysiology, something is wrong with the body. We use classic presentations or case studies to help us with our description in pathophysiology. Now, it should be noted that when we cover the classic presentation, or the most common symptoms and presentation of the diseases, most people do not present, quote, by the book. Everyone has variations in their body and variations in their lifestyle and risk factors. So although in this course we'll study and test over classic presentations, you should note that in your clinical practice, there'll probably be variations that you see in your patients. Now, there's a typical framework that we use in this course to help us organize what we know about different diseases. This framework will include the etiology, or the cause of the disease or condition. It'll include pathogenesis, which is what is actually going on in the body or what is going wrong. And manifestations, which is how you know you have the disease. Now, the etiology, or the causes, can be a variety of things. Maybe pathogens like bacteria or viruses, maybe an injury, maybe chemicals or toxins which can cause a disease. We also look at nutrition. We can have nutritional excesses like obesity, which lead to diseases, or maybe insufficient or not enough nutrition, which can also lead to disease development. We also know that etiologies include maybe genetics, if you have a genetic disorder or a genetic mutation or defect. We know that some causes are congenital, meaning that you are born with a physical abnormality. And sometimes we even label things as a syndrome, which means there's a collection of signs and symptoms that are common in the disorder. Most often, though, we say that the cause of something is idiopathic, which means we actually do not know the cause. Sometimes the cause can be something called iatrogenic, which means that maybe a medical procedure or a medical treatment actually caused the disorder. For example, if we're going to insert a chest tube and we deflate the lung accidentally by puncturing it and the patient has a pneumothorax, that was an iatrogenic cause. We actually caused that to happen. We also know that with infections, they can be either nosocomial, meaning they're hospital acquired, or they can be opportunistic, which means that a weakened host is more susceptible. Again, pathogenesis is what is going on or what is going wrong inside the body. Manifestations are how you know you have the disease. So with manifestations, we talk about either signs or symptoms. Now, signs are objective and observed. Perhaps maybe if the patient has a temperature, you take the temperature and you see the temperature, or they have high blood pressure and you take the blood pressure, or they have a rash. Symptoms are more subjective and reported. Maybe the patient tells you that they're nauseated or that they have a headache. Now let's move on to some other terminology. So duration can be either acute or chronic. When we're talking about acute, it's often shorter term, maybe less than 3 months. And a lot of times we use acute to describe maybe full intensity of the disease. Chronic tends to be more long term, maybe greater than 3 to 6 months or indefinite. The thing about long term is often with an illness that's chronic, we see exacerbations where maybe it gets worse at times. And sometimes we see remission where maybe the symptoms go away for a while or become silent or maybe gets better for a period of time. We can also use the terms preclinical and subclinical. This means that the disease is not yet evident and maybe not all the signs and symptoms are showing. We'll say signs and symptoms not showing. We also sometimes call this asymptomatic. Latent is another term. Latent can mean a lot of different things. Latent can be the time from exposure to the development of the disease. We also know that the latent period of time could be maybe the preclinical or the subclinical time where you don't have symptoms. It could also be what we refer to as the infectious or incubation period, where the patient's not showing any signs or symptoms yet. And latent can also mean when the disease is silent or dormant even. So it has lots of different meanings. Now, carrier means that the patient has the disease, but may not be showing symptoms or manifestations. When we talk about prodrome, that is the early part of the disease, where maybe the signs and symptoms are vague and not severe yet. So, for example, when you're getting a cold, maybe you wake up that morning and you kind of have a scratchy throat, but you don't have full intensity of the symptoms yet, but you know it's coming. Now, the clinical time period means the disease is at full intensity. Exacerbations means there's a flare-up of the symptoms. And remission means that the disease or the symptoms have gone away for a period of time or silent. Convalescence is our time of recovery. So if you're convalescing, you're recovering from your illness, and that's when the body returns to baseline. Now, sequela and complication can be a little harder to distinguish. Sequela is actually a subsequent condition related to the original condition. So with this, maybe if you developed heart failure after a heart attack, so it's directly related, the heart attack has damaged your heart and now you have developed the sequela of heart failure. Now, a complication is a development of a new, separate, or unexpected condition or disease. and even unrelated. So let's say you broke your leg and you had to lay in bed for a long period of time because you broke your leg and you developed the complication of pneumonia, which is not really related to your broken leg. It's a separate new condition because of the broken leg. Now we know there are predisposing factors, which are like risk factors. That means they may contribute to development of disease. And then we know precipitating factors do cause the disease or contribute to the disease. So let's move on over here to diagnostic tests. With diagnostic tests, there's some terms that you should also be familiar with. The first is reliability. With reliability, we know that repeated tests give the same result. That means they're reliable. So with reliability, it means more that it's accurate. Validity is a true result. So you want a test that's not only reliable, but also valid. And that means it's measuring what it should measure. Now, sensitivity and specificity are also two important things with diagnostic tests. Sensitivity picks up true cases. It means it's sensitive enough to find the disease. Where specificity distinguishes who does not have the disease. With that, it means it's specific to who has the disease. Now let's talk briefly about epidemiological terms. Incidence is the number of new cases. One of the ways I remember this is new and incidence. There's two N's there. Prevalence is the number of existing cases. Now, morbidity is the term for disability. Some diseases cause a lot of morbidity. Stroke, for example. A lot of people don't die from ischemic strokes, but they have a lot of morbidity or disability from ischemic strokes. However, mortality is really about death from disease. We know that hemorrhagic strokes actually have a high mortality rate. A lot of people die if it's a hemorrhagic stroke. And we know that age, ethnicity, geographic area, gender, socioeconomic status, lifestyle, educational status, and occupation also affect disease patterns, and epidemiologists study these patterns. Now, the last thing we want to talk about is our levels of prevention. And there are 3 levels of disease prevention. Primary is to remove risk completely. And to actually prevent the disease. And we know immunizations are really good for this. Secondary prevention is to identify the disease early through screening. So if you go to a health fair and they're checking blood pressure or blood sugar, it might have helped to early identify diabetes or even high blood pressure. And tertiary is treatment to prevent further deterioration. So you have the disease, but you're receiving treatment to try to prevent your body from getting further deteriorated from the disease. So with that, perhaps if you have cancer and you're receiving chemotherapy or radiation, those treatments are tertiary to try to keep the cancer from spreading. And here you go. Here is your completed map. Now, if you found this video helpful, remember to like and subscribe so you can easily find our other pathophysiology videos.